All right, good afternoon and happy Wednesday, I think. Please remember to mute your microphones. And immediately following my briefing, Elliot Harris, Assistant Secretary-General for Economic Development and Chief Economist of the UN Department of Economic and Social Affairs, will brief you on the launch of the World Economic Situation and Prospect Report's mid-year update. So do please stay connected after we're done. I want to give you a heads up that tonight we will be putting out a policy brief from the Secretary General in which he presents a series of recommendations to ensure that mental health services are fully included in the COVID-19 response and recovery plans. The policy brief will be released at 11 p.m. New York time, and we will also have a video message recorded by the Secretary General released at that same time. This morning, the UN Sustainable Development Group met virtually to coordinate support so that countries can overcome and recover better from the pandemic. The Deputy Secretary General, Amina Mohammed, and the group chair underscored that the pandemic is a global health, humanitarian, and socioeconomic emergency. Behind the numbers are people and families. COVID-19 placed many things on pause and also exacerbated grave existing problems, including inequality and climate change. The way the UN system responds will now be we'll put our reforms in action to enable us to better address this development crisis in full emergency mode, said the Deputy Secretary General. The group members also reviewed progress in reinforcing humanitarian development collaboration, as well as consolidating the reforms launched by the SG to strengthen the UN's support of the 2030 Agenda for Sustainable Development. And this morning, the Undersecretary General for Political and Peacebuilding Affairs, Rosemary DiCarlo, briefed the Security Council in close consultations on Lebanon. She presented the Secretary General's latest report on the implementation of Resolution 1559. Also today, regarding Lebanon, the International Support Group for Lebanon, which brings together the United Nations as well as a number of member states, took due note of the unanimous adoption by the government in Beirut of its financial recovery plan as a constructive framework for future reforms. The group also noted the government's decision to request an IMF program as a first step in the right direction. And in a statement issued yesterday, you will have seen that the Secretary General strongly condemned the horrific attack on a hospital in Kabul. The attack killed and wounded dozens of people, including women and children. The Secretary General said he is also following with concern the escalation of violence in Afghanistan. He expressed his deepest sympathies to the families of the victims and to the government and people of Afghanistan. The Secretary General reiterated that attacks against civilians are unacceptable and that hospitals, medical facilities, and their personnel have a special protection under international humanitarian law. The Secretary General emphasized that those who carry out such crimes must be held accountable. The Special Representative of the Secretary General for Children Armed Conflict, Virginia Gamba, also issued a statement stressing that countries around the world are focusing on their response to COVID-19. It is fundamental that hospitals and healthcare institutions, as well as the patients they host, are protected. Turning to South Sudan, our peacekeeping colleagues tell us that the Ministry of Health has confirmed that 2 COVID-19 cases in protection of civilian sites in Juba. Our colleagues said that this was not unexpected given the rising number of cases confirmed within communities across the city. The UN continues to urge displaced people on the sites to follow prevention measures such as social distancing, hand washing, and isolating themselves if they become sick. As we told you yesterday, the UN has been broadcasting prevention messages through our Radio Mariah station, as well as from inside the protection sites. The UN has doubled the water supply and increased the number of hand-washing facilities. We've also distributed 3 months' worth of food in advance. This means that people don't have to travel often between the camps and the town to purchase supplies. The UN will continue to provide this support, and we are encouraging people living in the sites to follow prevention measures as much as possible. And on Libya, the heads of the UN's principal humanitarian bodies have just issued a joint statement in which they say that conflict and the pandemic present a significant threat to life in Libya. The health and safety of the country's entire population are at risk. They say that close to 400,000 Libyans have been displaced since the start of the conflict 9 years ago. Around half of them within the past year since the attacks on the capital started. Despite repeated calls for humanitarian ceasefire, including by the Secretary-General, hostilities continue unabated, hindering access and the delivery of critical humanitarian supplies. The UN humanitarian leaders urge all parties to the conflict to protect vital water supply facilities, and they expressed alarm that water facilities have been deliberately targeted or indiscriminately attacked. This impacts thousands of women and children and impedes efforts to implement basic virus prevention measures, such as hand washing. They reiterate their support for the Secretary-General's call for a global ceasefire and a humanitarian pause to save lives and enable the Libyan authorities and their partners to devote their energies to stopping the spread of COVID-19. The international community must not turn a blind eye to the conflict in Libya and its catastrophic impact on civilians, including migrants and refugees across the country. That statement has been shared with you. And in another joint statement, the heads of the UN's global health, human rights, and development institutions said in a joint call to political leaders to address the vulnerability of prisoners to the COVID-19 pandemic. The statement was signed by Khadafati Wali of the UN Office of Drugs and Crime, Dr. Tedros of the World Health Organization, Winnie Byanyima of UNAIDS, and Michelle Bachelet, the UN High Commissioner for Human Rights. They all stressed the need to reduce overcrowding, respect human rights, ensure health and safety and human dignity, ensure access to continued health services, and to adhere to the UN rules and guidance, especially that of the World Health Organization. The full statement is also online. And UNICEF today warned that an additional 6,000 children could die every day from preventable causes over the next 6 months, with the pandemic weakening health systems and disrupting routine services. This would mean that the number of children dying before their 5th birthday could increase worldwide for the first time in decades. More information on UNICEF's website. And the UN Conference on Trade and Development, otherwise known as UNCTAD, today said that the pandemic has led to a 3% drop in global trade in the first quarter of this year. This downturn is expected to accelerate in the next quarter, with UNCTAD forecasting a 27% decline. This has been accompanied by marked decreases in the commodity prices, particularly fuel, as well as minerals, food, and other raw materials. The UN agency said it would now update its trade forecast on a monthly basis to provide policymakers with up-to-date data so they can make better decisions. You will get more on the economic impact of the pandemic with Mr. Elliot Harris in just a short while. And the 2020 World Health Statistics published today by the World Health Organization show that all over the world, the COVID-19 pandemic is causing significant loss of life and disrupting livelihoods. It's also threatening the recent advances in health and progress towards the global development goals. According to the World Health Statistics Report, life expectancy and healthy life expectancy have increased, but unequally. The biggest gains were reported in low-income countries, which saw life expectancy rise 21%, or 11 years between 2000 and 2016. Among the challenges are access to quality health services and the inability to pay for health care. On current trends, WHO estimates that this year, 2020, approximately 1 billion people will be spending at least 10% of their household budgets on health care. Dr. Tedros said the pandemic is highlighting the urgent need for all countries to invest in strong health systems. And today, the head of the Human Rights Office in Iraq, Danielle Bell, warned that women in that country are facing several additional challenges right now. She said that restrictive measures adopted to fight the virus in Iraq heighten the risk of domestic violence. At the same time, they substantially reduce the ability of victims to report abuses and seek effective shelter, support, and access to justice. And in the Democratic Republic of the Congo, our humanitarian colleagues tell us that in the eastern province of Ituri, some 200,000 people fled their homes in the last month, following large-scale military operations. Clashes between the Congolese army and armed groups, intercommunal violence, and land-related conflicts have all contributed to the deterioration of the humanitarian situation. Since the beginning of the year, over 1,300 sexual and gender-based violence have been recorded in the Congo. 40 health facilities were destroyed or looted, and 80,000 children are out of school due to displacement or school attacks. Insecurity has severely hindered the humanitarian response. Some humanitarian organizations have suspended operations in part of Ituri, and in recent weeks, about 66,000 people have been cut off from aid. Despite these difficulties, the provisions of medical support, food and non-food items continues in more accessible areas, and our humanitarian partners are looking for windows of opportunity to resume their activities, despite chronic underfunding for the response. As of today, only 11% of the $2.1 billion requested in the DRC humanitarian response plan has been funded. And tomorrow, following my briefing, our friend Rima Baza, spokesperson for the President of the General Assembly, will brief you on the same virtual platform. And I want to end with some big thanks and welcome news from Moldova. They have fully paid up their budget dues for this year. With its full payment to the regular budget, 90 member states have now paid up for 2020, and we thank all of them very much. Okay, let's go to your questions. Let's see what our trusted moderator tells me to do. I see an empty chair in Zach's place. I hope that's not a sign of protest. All right. Hold on a second. I was going to complain somebody has their mics on, but that's me. All right, Toby.
Hi there. Good afternoon, Steph. Thanks very much. I was hoping to return to the attack on Sunday in the Sahel in Mali. I was hoping to get some more color from you on what this attack on peacekeepers means. Do we see the security situation in the Sahel right now? Do we see these armed groups taking advantage of vulnerabilities produced by the pandemic? And just more generally, can you talk a little bit about what it means for peacekeepers to die in the line of duty, and then specifically what it means for the security situation in the Sahel? Thank you very much.
Well, first and foremost, I'd start by saying that our peacekeepers in Mali have been suffering the most attacks of any peacekeeping mission. They have the highest casualty rates, though because of a number of mitigating measures that have been put in place over the last 2 years, I think those rates have been falling in terms of better force protection, better equipment. The fact remains that Mali remains a very dangerous place for peacekeepers to operate. Why? And a number of underlying factors. One is a lack of progress on the political track, and of course we've seen the continued activities of various armed groups, of various terrorist groups in the region. The situation in the Sahel overall remains one of great concern to the Secretary-General. I think I would refer you to the report he just issued not long ago on the situation there. The lack of consistent and predictable funding to the G5 Sahel force has also been of concern, and the lack of funding, in a sense, to address a lot of the underlying causes in the region that have been leading to the violence. Whether or not we have seen a spike in attacks because of the pandemic, I'm not sure that's an analysis I'm willing to accept at this time. All right. Who else do we have? Let's go back to our list here. Mario.
Hi, Steph. Can you hear me?
Mario, great beard.
Thank you. I know you've been asked about this a few times before, but do you have any update on planning for the high-level week in September? Is the ESG making any recommendation to the member states on how the organization is going to proceed, or is he preparing any recommendation?
Yeah, we're a lot of factors will be at play. Notably, we don't know what the state of the city of New York will be at that time. That will be obviously be a driving factor. The state of the pandemic worldwide. The Secretary-General is engaged in discussions with the President of the General Assembly. I'm sure Reem will have more for you tomorrow. Ultimately, how the General Assembly will be organized will be a member state decision. The Secretary-General, as representative of the Secretariat, will be there to support the member states in whichever way they want, and obviously to offer advice, notably medical advice from our medical services. But I think the short answer is that no decision has been taken as far as I'm aware. Richard Roth, I think Richard, I think I answered your question, which was in fact Mario's question. Abdelhamid.
Thank you, Stéphane. Yesterday, the Palestinian Prime Minister Mohammed Shtaya said that the Palestinian leadership is meeting this Saturday that will include Hamas and Jihad, and they will take hard decisions regarding the Israeli plan to annex almost 40% of the Palestinian land. Is the SG doing anything? Did he call anyone? Did he speak to the Palestinians? Did he speak to the Israelis? Is he doing anything regarding this grave situation that will start on July 1st?
Look, I think Mr. Mladenov has been in touch with all the parties. Our position on any annexation is very clear. We have said clearly it would derail a two-state solution, to say the least. So it is something we are obviously fully aware of, and that Mr. Mladenov is engaged with the parties. Okay, Maria.
Hi, Steph. I have a question about statistics, again, this time about Russian statistics. New York Times published an article 2 days ago claiming that the real number of deaths in Russia caused by COVID-19 is much higher than official numbers. And they are not only accusing the government of Russia, but also the doctors of putting the wrong cause of death. Which is quite serious, like personally for me. I'm sorry I get emotional here, but I ask you not only as a journalist, but also as a daughter of a doctor. And do you have like the official statistics from Russian government, and do you have your own United Nations estimations of what is the real situation there?
No, we do not have, I mean, let me put it this way. We as the Secretariat do not have statistics that are independent from governments, right? Whether it's the UN system relies on government statistics. You know, there are some exceptions in terms of what the UN presence is in different countries, if it's a peacekeeping mission and so forth, if it's a large UN presence in which we're working closely within the health department and other things. That's not the case in Europe, or not the case in Russia. So the only statistics that we have, as far as I'm aware of, are those of the government.
Okay, but Secretary-General declared the strategy of fighting against misinformation and analyzing the news in terms of giving correct information or incorrect information. Can you at least estimate this article in particular? Do you have the reason to believe that the real number of deaths caused by COVID-19 can be higher, and that the government is hiding something?
No, we have no investigative mandate, or I have no ability to judge the validity or veracity of that reporting. What is critical, and this applies to every country, right, all member states, is that the most up-to-date and the most accurate statistics are obviously a critical tool in fighting the virus. Okay, Mario, hold on a second, let me look. Oscar had a question on the Amazon. President Bolsonaro deployed a military force to protect the region from deforestation. In this regard, do you have any information on what the efforts are to protect indigenous population in the region? We reported back a couple of weeks, we reported back on what efforts WHO is, on the UN system's efforts on protecting the indigenous population. We will try to give you an update on that as soon as we can. Okay, I think that's it. Any other Iftikhar typed in a question. Following the 2 deadly attacks in Afghanistan, President Ghani has placed the Afghan army on offensive mode, raising possibility of resumption of full-fledged conflict. What does the Secretary-General have to say at this time? We're obviously watching that situation very closely and with concern, following the violence that we saw yesterday, the escalation of attacks, the hospital, the funeral. For the Secretary-General, our hope is to see progress towards intra-Afghan negotiations, and we would encourage all parties to move in that direction. Thank you. Ibtisam.
Hi, Steph. My question is on Libya. Given the constant escalation in Libya, why is it taking so long to have a new envoy? And could you also tell us more about who is in contact with the different parties, whether, I know the deputy probably, but also whether the Secretary-General is in touch with Mr. Haftar or others there? Thank you.
No, I'm not aware the Secretary-General has been in touch directly with General Haftar. The mission is being led by the acting Special Representative, Stephanie Williams. She continues to be in touch with all the parties, delivering a message of a call for cessation of the attacks, for protection of civilians, and resumption of political talks. Appointing a special representative, to put it mildly, is a process that involves the Secretary-General,